Recently, President Barack Obama took the unusual step of appearing in a talk show parody with comedian Zach Galifianakis to urge more young people to sign up for health coverage under the Affordable Care Act. The video boosted visits to the healthcare.gov site, but whether it brings more enrollment remains to be seen. The deadline is at the end of March. The New Mexico Health Insurance Exchange faces the same challenges here, reaching young people. If they don't sign up, that could threaten the viability of the Affordable Care Act. NMIF correspondent Gwyneth Dolan talks with officials from the New Mexico Exchange, the insurance industry, and from student health at UNM about strategies for reaching young invincibles.
My guests today are Martin Hickey, who is a board member of the New Mexico Health Exchange. He is a physician and the CEO of New Mexico Health Connections. Dr. Beverly Kleppel is a physician and the director of UNM Student Health and Counseling. Jake Foreman is a UNM grad student and an outreach coordinator. James Tomei is an independent insurance broker with HBW Insurance and Financial Services. Thank you all for being here today to talk about health care.
Happy to be here.
As Jean mentioned, President Obama is making a full court press on his health care plan by trying to recruit young people who have not been signing up as he'd hoped. He used an announcement of his college basketball tournament bracket, his NCAA bracket, to pitch a page on the White House website called the ACA bracket. The page invites visitors to vote for their favorite reason to get covered, using gifs of prancing ducks, a clumsy twerker who falls off a bathroom counter, and kooky cats. Martin, is this really our government's plan to get young people to buy health insurance? Lolcats, that's our plan?
Well, yeah, actually, this is the home stretch, and so they're doing everything they can to get the attention. The early people who signed up for the exchange tended to be older, and so this is the push to balance the numbers, and so we have a lot of healthy coming in to help keep premiums down to bring the young people in. So you're probably going to see really wackier things than that.
Is it like a two-pronged approach? There's like the mom guilt angle and there's the lolcat angle, right?
Oh, well, even at my age, I can attest to the mom guilt thing, so I'm sure it's going on with the young people as well. But that is absolutely, I have worked on certain things with the White House, and that is a main strategy, is to get mom on the phone and to bug you every night until you get it.
Well, yeah, I'm familiar with that strategy, actually. Jake, you're out there talking to young people. What are you hearing from them?
Well, I'm actually hearing from them that they're not necessarily invincible. You know, that's what I'm hearing, is that it's more like they are invisible. You know, as young people, we were never necessarily asked at the table to begin with. And then now, even with these strategies, we're still not being asked what would get us to sign up for health insurance. And the number one reason, I feel, is financial. You know, it's all about not being able to afford an extra bill.
Well, you know, there is, I mean, I can see this line of thinking like, well, I pay, you know, $100 a month for my phone bill, but I get unlimited data and unlimited texting. And so now I'm supposed to sign up for healthcare and pay something like $100 and I get nothing.
Right. And then, you know, we were having this conversation before we got on this show. We don't necessarily learn about financial literacy. We don't even really learn that much about health literacy in schools, even in college. And this is what we're finding with students, is that we need to integrate this into curriculum that we're learning. We need to integrate this into classes because it's all connected, whether it be about health, whether it be about economics, whether it be about education. These are all interconnected issues. And I think that young people are a little more critical than we'd like to believe they are. You know, we understand, you know, certain things, and we have access to information due to the internet. We're always on the internet. And, you know, we have the ability to learn, we just don't have the motivation.
I can't imagine any young people escaping your grasp when you're out there trying to persuade them. You're good at that. Beverly, we have about 30,000 students in the UNM student body. Can you give me an idea of how this huge group of people interacts with health insurance? I mean, how many of them are on their parents' plans or have other forms of health care? What's the picture?
Well, the surveys we've done on campus, the uninsured rate historically has been about 15%, which is actually a little lower than New Mexico at large. And it's such a heterogeneous population that where they get their health insurance, you know, varies from they're employed. The average UNM student works 27 hours a week at a job. So they get it through their employer, some of them, through their parents, particularly with the addition of the opportunity to stay on your parents' insurance until age 26. And then we've had historically a health insurance policy, student health insurance policy. Some have been signed up for that voluntarily. So there's been, a variety of different ways people obtain insurance on campus.
That number is a lot lower than I thought it would be. James, I've been on the exchange and looked at some of those plans. It's a little intimidating. There are so many choices for young people who maybe haven't been through the process of shopping for a car and a car loan, or haven't been through buying a house and getting a mortgage. How are they supposed to look at silver and bronze and deductibles and copays and figure this out?
Well, the best way is actually to talk either with a navigator, a healthcare guide, or an agent, so you can go over a lot of the plan specifics. We have over 40 plans that are available, and a lot of people don't realize there is a great difference between the different metal plans. A gold plan is going to be a much richer benefit than, say, a bronze plan, and a lot of people who are under 29 could actually apply for a catastrophic plan, which are very reasonable, especially when the subsidies or the assistance is calculated into the equation.
Right, and the assistance can be phenomenal. I mean, there are, for some people, for some young people, it could almost be zero premium when you figure in their income level, which is lower, and the federal government support. There are people who almost end up paying nothing, not only for the premium, but also for copays and what have you. A family of four, say, in their early 30s or late 20s, with a household income of around $30, $40, even $50,000, they could get a premium as low as $100 a month. And depending on the income, maybe get the kids covered as well. And there's Medicaid for the kids. So it's just, a lot of people don't understand that first price that you see, that's probably not the price, particularly for the younger generation, because they're not making a lot of money, and therefore they get federal support to help pick up that premium. And then the other thing I think that people need to look carefully at, and this is absolutely where what James said, you got to get a broker, or you got to get a health guide to help you. Because you may see a low premium price, but what's kind of hidden in that are what are called out-of-pocket expenses, deductibles. And for some plans that have a low price on a premium, you may end up having your first office visit and it costs $300, and you go, hey, that was just supposed to be a $20 copay, and then you go get your pharmacy, and that's another $200. And those are what we call high deductible, high out-of-pocket, or first dollar plans. So the cheapest is not always the best. You may, particularly if you look within a category. So if you go within bronze or silver, sometimes the better plan is a little further down. So you need to look at, it's there, what are the deductibles, what are the out-of-pocket expenses. But that's, again, this gets complicated. Having a broker and a healthcare guide, absolutely great to help you.
So can you say I'm 29? Indulge me. And I am, looking for care here because I'm not on my parents' plan anymore, and I don't get it through my job because I only work 27 hours a week while I'm going to UNM. Can I just call any broker out of the phone book?
Actually, no. If you go on the Be Well NM website, you can actually look up to find out which brokers are actually certified in your area by your county, and find someone that's going to be able to help you at that point.
So is this what you're counseling folks to do? So just go to Be Well NM, find a broker, call them, and then you can say, well, look, I'm healthy. I don't take any drugs. I have no prescriptions. I never go to the doctor. Which plan should I get? And a broker will tell you?
Definitely, that's a huge part of the outreach that we're doing at UNM. But we're also talking about the basics of the Affordable Care Act in general. We need to see this from a historical perspective, right? We need to back up a little bit, I think, for our younger generation to be like, okay, wait a minute. When did this start? And we now know people have been working on healthcare reform for decades, And we also need to see, okay, how did the plan, get passed, right? What happened? There was a lot of things that happened. A lot of things that were in the plan were actually taken out of the plan. Why? You know, that's another question that a lot of people are asking. How did this come about? You know, how did health reform become about health insurance reform?
What's the number one question people ask you?
The number one question that people ask me is
Is my
basically
birth control covered?
no, it's actually basically it's basic questions about health insurance and insurance in general. What is a deductible? What is a premium?
Right.
You know, do I have to pay for services even if I have health insurance?
Right.
These are the basic questions that I'm talking about when we're talking about like health literacy, you know?
Beverly, let me ask, well, what were you going to say?
Oh, I was just going to say, I would advise you, if you were a UNM student, to come to the student
Yes.
student health and counseling, where we have a navigator
Uh-huh.
that's scheduled a certain number of days a week to meet with students. And depending upon your income, they can sit down with you and see whether you qualify for Centennial Care.
Right.
And then, if you don't qualify because you're working too many hours.
Centennial Care was the UNM Salud plan and Medicaid wrapped into one now?
Well, Centennial Care is the Medicaid plan for the state, and so it may be that your health care, if you qualify for that, then that may serve as your insurance policy. And instead of going to the exchange and signing up for a policy that the cost may be offset in the exchange as well, but that's what I would advise you to do first.
Head over to
Is
SHAC,
that-
Student
that's
Health and
exactly-
Counseling.
that's exactly
I just
right.
learned that
And
acronym.
I should make the point that this is going on because I know this program goes out to the state. This is going on in all the college
Yes,
campuses.
that's right.
And CNM, who have a lot of part-time working people who already have families, they don't have that 15% figure, probably even close
Yes,
to it.
not even close to it,
And
yeah.
CNM has resources as well to be able to help. I know New Mexico State, we're doing a lot of work down there. I know Portales. So people should check in with their college health centers to find out where they qualify, because many will qualify for Medicaid, but some will qualify for the exchange, and then they will get these incredible benefits to help them out. And, you know, just as you were talking, you know, one thing, I've got kids who are kind of like, what do I need this for? I mean,
They see themselves as invincible. and
Absolutely. You know what?
Until something happens,
you know,
you
that
don't
old
think it
bumper
will.
sticker, something happens, and it does happen. and when it happens, there's a bill associated with that that can be anywhere from $600,000 to $100,000. I mean, even in an emergency room visit. And you know what? If you've got some assets or resources, those organizations are going to sit down with you and say, we want to work out a plan to pay this off over time. And unfortunately, if that can't be worked out, they are not reticent about going to collection agencies with folks. So this could, you know, you've been saving money for graduate school, then you have
Yeah.
this happen, boom, that's gone.
We've only got a couple minutes left, so let me ask you guys a couple quick questions. If I, you know, go to Be Well NM, find an insurance broker, and call, can I sign up with that broker, or then do I have to go back to the website to sign up there?
No, you can actually sign up with the broker.
You can sign up with a broker that you find.
Right, and we can even, for some of those outlying areas, let's say that I get a referral from Taos or something like that, we can actually do a screen sharing, or we can do a conference call, and we can actually do it that way and get on the healthcare.gov call center, and then still be able to enroll them, and they can look at all the different plans and all the different prices and educate them prior to the enrollment. That way it makes it as smooth as possible.
What's the deadline?
March 31st.
What happens, Jake, if they miss the deadline?
Well, there's many things that could happen, but you basically, you know, I don't want to phrase it in the wrong way, but basically you're gonna have basically a fee on your taxes, you know, if you don't sign up. And so we're seeing this as a long-term project as well. After March 31st, it doesn't mean that we're going to stop working. We're going to continue our outreach. And I really want to bring up, you know, what you were talking about, because what made me so passionate about working on this project is that access to health insurance is a social determinant of health. Meaning that, you know, this is a social justice issue, and we need to frame it like that for young people. And we really need to talk about health in general. The biggest thing that I tell students is that we have to take care of our health. No matter if you have health insurance or not, it's going to be expensive to go to the hospital, right?
Yeah.
And that's an important thing that we need to talk about.
So on an individual level, if you miss the enrollment deadline of March 31st, is it, then you're not going to be able to sign up until
Until
next
November
year.
15th.
November
And
15th.
insurance will not start until January 1st, 2015.
But and we only have a few seconds left, on a bigger level, if not enough young people sign up, what happens?
There's next year. This is going to go on. The horse is out of the barn, and it is the law. It's likely not to change much, and maybe there's an opportunity in 2016. But as this progressively moves forward over the years, it will get there, and we'll get to the balance. Massachusetts, which is covering almost everybody in the state, because they cover so many people, it's called the law of large numbers, but so many people are in, the rates are coming down in Massachusetts
It's
now.
a bit of a cultural shift, and so anything like that takes a long period of time, or it takes a little while to have people recognize, I need to get health insurance, the education to get out, people to understand, how they're a part of the big picture. And so that takes a little bit of time, and so we just keep working at it.
Thank you all so much for being here, and we will have more resources and information on our website.
As always, all of us here at New Mexico in Focus appreciate your time and your effort to stay informed and engaged. Catch up with us anytime on Facebook and Twitter by searching New Mexico in Focus. And you can find archived interviews and bonus material from our shows on our YouTube channel and at newmexicoinfocus.org. I'm Gene Grant. We'll see you next week in Focus.